Hey everyone, it's that time again. We love the 11 o'clock hour, so we'll get started. For those who have just signed on, give us a shout out in the Q&A box. And since we have many familiar names and repeat attenders, what has been your favorite part of the CONNEXT conference so far? Let us know in that Q&A. While you're doing that, I'll take care of the introductions and housekeeping items. My name is Lacey Bergevin, and I'm going to be your host today, so welcome. We are scheduled for 60 minutes with 10 to 15 minutes of Q&A at the end today. Speaking of Q&A, we encourage your participation throughout the session, so please don't be shy. The Q&A box will remain on your screen throughout the presentation. Please type questions in at any time. Also, if you have technical difficulties during the session, you can seek help in this box with our team. We'll be sending the recording via email today with CE info, and we'll be posting recordings daily in the Facebook group. Our goal is to offer CE credits for all courses. The evaluation and quiz will be sent today, and your CE certificates will be issued within 1 to 2 weeks. Okay, with that out of the way, it is my absolute pleasure to introduce our presenter, hygienist Machell Hudson. Machell Hudson is the Director of Oral Systemic Wellness for Granbury Dental Center and a hygiene consultant with Productive Dentist Academy. She holds advanced laser certification and also arterial wellness through the Bell-Donin method preceptorship. Machell is on the marketing board for American Academy for Oral Systemic Health, co-host for Reflection Health podcast, AOSH's Facebook Live show with Dr. Chris Kammer, blogger, specialty hygiene consultant, and enjoys speaking about her passion for oral systemic health throughout the country. On top of everything she is already doing, she is now earning a health coaching certification through Institute for Integrative Nutrition. Her favorite position is, of course, inside of her dental practice caring for her patients. You guys are going to love Machell. She is one of the most positive and bubbly people that I have ever met. We also have Dr. Kim Cooch joining us. He's the founder of Carie Free and an internationally recognized speaker. He's published hundreds of papers in dental and medical journals, and we're lucky to have him as our resident Caries risk management expert. Dr. Cooch, I'll let you officially hand it off to Machell.
Thank you, Lacey and Machell. I just have to say you are one of my favorite people. You are such a bundle of energy, and I really enjoy speaking with you and talking about all these topics, and I am so excited to see your presentation today. You have done so much for our profession, and everybody, you guys are in for a real treat. This is a great way to wrap up the week. So, Machell, take it away.
I'm so excited to be here, and Dr. Cooch and Lacey, thank you so much for that introduction. I don't know how many of you know Dr. Cooch, but he is, and I know this is my presentation, but y'all, he's one of the kindest and most brilliant human beings on the planet, and it is such an honor to get to play a part in this event. And so we'll just, I'll get started now. Don't let the health of your mouth break your heart. What in the world is a dental hygienist talking about heart health for? Well, many of you, because I can see, already know how important this is. We learned a little bit about it in school many years ago, but little did we know just how big that importance was going to be. Fast forwarding to 2020 and more and more research that comes out. Just the growing need to educate on that oral systemic component is so important. The picture in the upper right, if you're looking at the screen, is a picture of my sweet gentle giant. Those of you who I'm friends with, that is my son. I adore him. He's 6'5". This is an older picture. The man sitting next to him was my stepfather. He passed away. In 2017, he had COPD, congestive heart failure, diabetes. He also had periodontal disease, and he had many endodontic infections, and so he really was just a ball of inflammation until that sweet man passed away. The woman sitting next to him with that ginormous smile is my beautiful and precious little mama. She's like 5'2" and just the sweetest thing in the whole world. And she has congestive heart failure, COPD, periodontal disease, and has also had some endodontic infection. And she has uncontrolled hypertension. And so as you can see just from that, my why is huge. And along with that, I just really love people, and I love taking care of our patients. We are in the best profession in the entire world, and I love that I get to play a little part in that. And given our current situation, we're all feeling a little uneasy, uncomfortable with our mandated corona staycations. So I know that if you go to the grocery store, if you're out in the park walking the trails, it's kind of a melancholy feel. And I know that a lot of people are dealing with stress, and people are scared. And so I strongly encourage everyone, just smile at your neighbors, of course, from 6 feet away, and wave at them, because like the name says today, give a stranger one of your smiles. It might be the only sunshine he sees all day. And it just really feels good to be good to people. So I just wanted to share that. Heart attack is the #1 cause of death in the United States. Stroke is the #1 most debilitating. It's also the most preventable. Cardiovascular disease kills someone in our country every 37 seconds, takes more lives than all cancers combined. And thanks to Drs. Brad Bell, Dr. Amy Doneen, and Dr. Vigorist, we know that up to 50% of heart attack and stroke is due to oral pathogens. Endo is a life-threatening matter. So, doctors, I am not here to tell you how to do your job. I would never do that. I work for the best docs, and some of the best docs in the world, Dr. Bruce Baird and Dr. Jeff Buski, and they have taught me so much. And then as I got into this oral systemic world, I can't unknow what I've been taught. And what I've learned from all of these amazing people like Dr. Cooch. And so I have to just share. I'm sharing. This is an opportunity. It's a new responsibility, or a bigger responsibility, for us to care for our patients. So I just want you to know that. I'm not telling you how to do your job. I'm just sharing today. And so this is a study that was released June 2019 from the Journal of American Heart Association. And I actually have these printed out in the office, and when we have patients that have infections, chronic infections, I actually will give them copies of some of our studies that we have. So with this one, I really want you to look, the background on it is that, we know that chronic inflammation is a risk factor for coronary heart disease and ischemic stroke. We also know that Viridans streptococci are known to cause infective endocarditis, and it also possesses thrombogenic properties. So I really love these two pictures, and that way, for those of you who aren't used to looking at what an arterial wall looks like, or even what a stroke would look like, this is a nice little visual. I also want you to get very comfortable looking or visualizing that arterial wall, the atheroma on that lower picture. That's years and years of chronic inflammation, or that atheroma has just laid down. And then you have that thrombus. Well, in this study, we're looking at the thrombi. So the study specifically looked at the Viridans streptococcus, and out of 75 patients, 69% of those were men having acute ischemic stroke. 84% of them, which was 63 of them, had the presence of the streptococcus group. 16% did not have the presence of the oral pathogen. So the conclusion is this may contribute to these events. I want you to think bigger because you think 75 people is not very much, but there's 795,000 strokes a year. 692,000 of those strokes are acute ischemic strokes. So I want you to think 84% of those individuals, we all know those people. We have those patients. We have family members. My mom has had a stroke 5 years ago this coming July. So here is a study that I really like. It was actually a study that was done in Turkey, and this is very new. This is from June. One of the questions or concerns that I get a lot when I do consults and when I speak from the attendees is the how are they going to talk to cardiologists? That collaboration piece, people are very nervous and they feel like we're not going to, like dentistry isn't respected enough, like what we do isn't important and it's just a tooth and it's just oral pathogens. What's the big deal? What's the big deal with that? Well, there was a study, and it's not this one, but there was a study that was done in 2014, and it was basically the same thing. It was questions sent to cardiologists, but it was on periodontal disease, and the results were the quite opposite. So what they did, there were 444 responses from cardiologists and cardiovascular surgeons. Questions that were asked, there were 12 questions such as the cardiologists and cardiovascular surgeons, their endodontic knowledge, dental exams, timing of treatment, and the results were 91.4% agreed that endo infections are important diseases to be treated. 66.6% of cardiologists refer to DDSs. 80.3% of cardiovascular surgeons refer to DDSs. Sorry, y'all. Those of you who know me are kind of smiling. 97.3% believe that endo infections could negatively affect heart health. So the reason that I added this is because I don't want you to be afraid to refer to your patients, doctors. We have to start communicating. It takes a village. We cannot do it alone. We cannot talk how the effects of oral disease if our patients, doctors do not understand it. When we start collaborating, value is going to increase. We're going to instill value within our patients, and we're also going to be able to spread awareness much better. So one of the things that I learned, my doctors learned from the Bell-Donine method when we went through preceptorship a few years ago was, you know, we do use the cone beam in our office a lot. We do a lot of high bridges. We do a lot of implants. We are a sleep practice, so we're doing a lot of expansion with sleep disordered breathing. Jeff Buski's fantastic at that. But one of the other things that we learned, and we're looking for calcifications, that's what we learned, carotid, through Bell-Donine method. But one of the things that we learned from them, and it was fascinating to my doctors and to myself as well, because I never looked at a cone beam for periapical pathology. Well, thanks to Dr. Bell, we now do look, and so this is just one study, and it was done in 2016. So 60 teeth with clinical and radiographic evidence of disease, 52 found lesions in both the cone beam with the PAs. There were additional found with just the cone beam, and then with the individual roots, 67 lesions were found with both, and an additional 33 were found with the cone beam. the picture is from the study, and of course the top is the PA and the lower is from the cone beam, and I just think that's a pretty significant difference. But I wish that I could add, we have a patient, it's one of Dr. Bruce Baer's and my patient, 24 and 25 were infected. You could barely see it with the PA, but it was blown up with the cone beam. And so we really do encourage you utilizing those if you have them in your practice. This is a patient, and as you can see, it's not. It is George Clooney, and I love him. And the reason that I do not have a picture of my patient is because I do not have a consent signed by him. I do have permission to talk about his story. We do a lot of collaboration. And in our office, we work with Dr. Gina Pritchard. Many of you Bell-Donine method doctors and hygienists know who Dr. Gina Pritchard is. She's just a beautiful human being inside and out. And then we also work with Dr. Paul Thompson of the Thompson Clinic here in Fort Worth, and he is quite a brilliant man as well. He has this patient, and he had been seeing him for quite a while, and 52 years old, the patient, Bob, we'll call him Bob until I have the consent signed. I will not use his real name. He very much believed in good health, and he loved integrative medicine. However, he did not value dental. It had been years since he had had an exam and or seen his hygienist. And so Dr. Thompson did his inflammatory panel, and we had really started working and creating a program between our two practices. And one of the things that he started looking for, knowing that was associated with oral health, were those inflammatory biomarkers, which we'll talk about later, but LP-PLAC2, MPO, and C-reactive protein. So the patient had all three of those elevated, so Dr. Thompson referred him to Dr. Busky and myself, and we further discovered that the patient was at moderate risk periodontal disease. He had endo on number 3, and then we sent him home the day of his first exam. We sent him home with a Rimmer's, and he has moderate obstructive sleep apnea. So Dr. Busky extracted number 3. The patient now has an implant. And we treated PERIO with PERIO therapy, and the patient is now in an appliance, and all of his markers are within normal limits. I do see him every 3 months for his PERIO maintenance, and he is using Curi-Free. We have him on probiotics and xylitol, big believers in those. And in our office, we always talk those foundational pillars of health. So we always talk nutrition with our patients. That's very important, reducing stress. And one of the things that we do on this slide is, and I love this, if you are not familiar with AOSH, American Academy for Oral Systemic Health, you have got to go check it out. There are some fantastic infographics within that website, and it's brand new. It's a brand new website. They've updated it. They've updated it. So, and it's beautiful. And one of the things that we can do with our patients, and you can print these out from AOSH, but I think it's really important to include the patient within those comp exams. So in our office, when a patient comes in, they're going to see Dr. Baird or Dr. Busky first, and then they see hygiene after that. So while they're waiting for Dr. Baird, we have them, of course, they've done their health history, and we have them sit down after x-rays and scans are done, and we have them fill out this risk assessment. Initially, they'll read the 12 facts you can't ignore. So that's a sneak peek into the mouth-body connection. And so you've already got your patients thinking before you doctors, or if hygiene, if you're saying your patients initially, either way, you're allowing the patient an opportunity to already be introduced to that oral systemic connection. The second piece to this is the risk assessment, and your patient is doing this. And again, it's allowing them to put their thinking cap on. And it's just another way to instill value. And so this is going to assess their heart health, diabetes, Alzheimer's, dementia, and airway. I really love this. I also love that our name isn't attached to it, so it's not like they came to our office and we just decided this is what your risk is. This is coming from another source. The same thing with the Caries risk assessment. I love this. We know that Dr. Cooch played a role in Canberra, and then he came back and he even simplified it even more so. And the top part of this is for the patient to fill out. And again, I love that every bit that your patient gets to do, it's going to allow them to think. And then when you doctors come in and you start doing your diagnosis and then you have that conversation, it really is going to help with that relationship piece, which is the most important part for all of us, because if we can create that healthy relationship, they're going to trust you, they're going to trust we hygienists, and they're going to become family for us. And we get to take better care for us because acceptance is going to go up. I love that. I love that Caries risk assessment too. So then let's get to periodontal pathogens and the effects on heart health, which we hygienists, this is our favorite part. We love PERIO. We don't love PERIO. We love taking, okay, we do really love those periotherapy patients just once. We want to get them healthy, and then we never, ever want to see them diseased again. So these two people, for those of you who do not know who they are two of the most important people in collaboration. So Dr. Brad Bell and Dr. Amy Doneen wrote this incredible book, Beat the Heart Attack Gene, and it was released, I believe, 2013. And I have a patient, two patients that really were the first to introduce me to Brad and Amy and Beat the Heart Attack Gene. But I didn't really understand it because they didn't tell me that oral pathogens played a role or in that book at the time. So one of my patients, who happens to be Dr. Jeff Buski's dad, I am allowed to talk about him, but he does not want me talking about all of his health. So everything I talk about is what I've been given permission. He went through a difficult time. I saw him for a few years. He was a patient that always presented with, always had inflammation, moderate to severe. I saw him every 3 months, constantly educating him. We had him on good products, but he was not compliant with products. He wasn't compliant with any of our recommendations, other than he was very good about coming every 3 months. He went through a very difficult health crisis, and he was introduced to Brad Bell. Actually, after reading their book, he sought him out. And so he came back, and all of a sudden, this sweet patient of mine starts looking incredible. And I learned, after, a few visits, I'm like, okay, what are you doing? What has changed your life? And he said, this book that I read, Beat the Heart Attack Gene. So this book changes anyone's life who's read it. You can't unknow what they teach you. They're kind people. They're brilliant. I love them. They probably think I'm a stalker because I see them and they're like, oh, Lord, because I can be across the room. And they see me, and Brad gets this funny little smile on his face because here comes that crazy Texas girl come running across the room to give them a hug. They're incredible people. And we owe them so much for this study right here, This is a peer-reviewed study that was accepted in November 2016. I read it in January of 2017, and I'll just, high-risk periodontal pathogens contribute to the pathogenesis of atherosclerosis. These doctors are the only doctors that I know of that in a peer-reviewed study that are bold enough to say that PERIO pathogens cause heart attack and stroke. It's incredible, and I give this to almost all of my patients. I just print copies so they can read it. And of course, some of it's really hard to read, but I just believe we give our patients folders, and I just flood them with information. So the abstract, I'll just read part of it, is periodontal disease is generated by microorganisms. These microbes can enter the general circulation, causing a bacteremia. The result can be adverse systemic effects, which could promote conditions such as cardiovascular disease. Level A evidence supports that periodontal disease is independently associated with arterial disease. Periodontal disease is a common chronic condition affecting the majority of Americans 30 years of age and older. Atherosclerosis remains the largest cause of death and disability. Studies indicate that adverse cardiovascular effects from periodontal disease are due to few putative and high-risk bacteria. These bacteria, P. gingivalis, AA, Treponema denticola, Panarella, and FN. I really like this graphic over here because you can see in the 20s that atheroma starts to lay down. So that's where that plaque starts to lay down. So really, I know that we really don't start heavily educating. Doctors really don't start talking to patients until they are actually showing signs of disease. So that's really going to be, the 40s, 50s, 60s. A lot of patients, it's when they have a stroke or when they have a heart attack. And really, we know it really starts much earlier than that. So we really have an opportunity to educate our young children, our parents, of young children, and everyone else. But let's really focus on that prevention and really knock that heart attack and stroke off the top killers in our country. It's lifestyle, guys. And girls. It's lifestyle, and we have a responsibility to educate our patients on that. So what we know is that there are 3 accepted essential elements in the pathogenesis of atherosclerosis, and we know that PERIO pathogens contribute to this, according to Drs. Brad Bell, Amy Doneen, and Vigorous. And so those 3 things are lipoprotein serum concentration, endothelial permeability, and then binding of lipoproteins in that arterial intima. So basically, you're just going to educate your patients that periodontal disease we know is a chronic inflammatory disease, and inflammation within the oral microbiome will result in a bacteremia, which is that blood that's mixed with those oral pathogens, and it's introduced into systemic health. So for this, we're going to talk how it affects heart health, but we have, we also need to talk about brain health, gut health. There's so much that we can talk about. I love this study. Part of it, of the peer review study, is they talk about other studies that actually show PERIO pathogens present within the atheroma. And so one from 2009, which was a coronary endarterectomy, and there's a picture of it right here. You can see on the left, you can see a healthy arterial wall, and then on the right, you can see a diseased arterial wall. And so what they did is they sampled that plaque, and from that 44 patients, 39 patients had periodontal disease. 36 specimens were positive for periodontal pathogens. Most common PERIO pathogens present were PG and AA, and 64% of the specimens had 2 or more oral pathogens present. And even one patient that did not have periodontal disease was positive for oral pathogens. This was one that was done in 2011, and it was done in the carotid. And 42 patients underwent the carotid endarterectomy, and then every atheroma had at least one oral pathogen present. Many had multiple, and once again, PG and AA were the most prevalent. Here is another study from the Journal of Hypertension, Periodontal Bacteria and Hypertension, the Oral Infections and Vascular Disease Epidemiology Study by INVEST. So 653 men and women of mixed ethnicities, Caucasian, African American, and Hispanic. An average of 7 samples taken per patient, plaque samples. And they looked at PERIO pathogens. They looked at the individual's education, BMI, smoking, diabetes, and of course cholesterol. And they concluded that that periodontal load greatly affects systolic and diastolic blood pressure. Systolic by 9 points, diastolic by 5. The PERIO pathogens present were AA, PG, TS, and TD, and they concluded that 3 times-fold increase risk for hypertension. That is huge. So we absolutely have to be talking blood pressure with our patients, and I just know that every single one of you are taking blood pressure on every single one of your patients. It's so incredibly important. We really, really do have an opportunity to save a life in this area. So here are blood pressure categories. This is American Heart Association, American Stroke Association. I'm sure you've all seen this before. And Drs. Brad Bell and Amy Donane and Dr. Gina Pritchard strongly educate on 120/70, but of course normal is considered on that diastolic less than 80. And any higher than that, I am educating my patients. I used to get, I've always talked to my patients if they had moderate to high blood pressure, but the minute that my patient said, oh, my doctor's watching that, I'm not concerned, it's white coat syndrome, I would get quiet. And after going through preceptorship, and then after this sweet patient of mine, I just will not do that ever again. We have to educate our patients. We can send referrals to their doctors. It is so important that we address blood pressure. This is a patient of mine, Jane, and I have been seeing Jane for almost 12 years, and for 8 years, Jane always had fantastic blood pressure. And then one day Jane comes in and she has a diastolic mid-90s and a systolic in the 150s. And it really concerned me. So, of course we talked about, life. Did she have any stress, current stress? And she did not. She was happy. I did encourage her to go to her physician, and she did. She was not placed on any medication, educated on lifestyle, because her lifestyle was very healthy. She came back a second time, so 6 months later, and Jane had, her blood pressure did not change. It was still high. I recommended she go back to her physician or get a second opinion, and she chose not to. Third visit, the same thing, and at that visit, y'all, I begged her. I begged her at that visit. It wasn't normal. That's not normal for anyone. It especially wasn't normal for this sweet woman who I'd had for many, many years with normal blood pressure. She chose to ignore me once again, and that 4th visit, she was 2 months late for that visit, and I walked out, and I have chills right now when I tell this, because I walked out and she stood up and she started crying, and she said, I will never not listen to you again. I am so sorry I did not take you seriously. And she said, I was the only one Now, I had also had Dr. Busky come in and talk to her, and he was very concerned as well. But we were the only ones who really were really concerned about her blood pressure. She had had a stroke. And it didn't need to happen. So please talk to your patients if they have high blood pressure. We have to talk about lifestyle. So I love the new AAP guidelines. We're not going to go over all of this. The focus really, and the only reason I have this here is because we have to talk diabetes. We know that there's that bidirectional relationship. AAP guidelines is recognizing that. We also have to start asking our patients what their A1C is. It's a responsibility because that's part of grading. So grading is the rate of progression. And so, you know, that grade B is less than 7 A1C, and then grade C is greater than 7. Guess what? Many of your patients are not going to know what theirs is. And so we have an opportunity. We can actually do that within our practice now. Cardiovascular disease, so complications due to diabetes. So an estimated 280,000 heart attacks yearly, 2 to 4 times increased risk of disability, or increased heart disease morbidity and mortality rates compared to non-diabetics. Sorry about that, guys. 60% chance of dying from heart disease. 68% of diabetics 65 years or older die of heart attack, and 16% die from stroke. And nearly 70% of older adults with diabetes die from heart disease. The one thing that I want to point out here is that 29.1 million Americans already have type 2 diabetes. So there was a prediction in 2001 that would not be reached until 2050. That astounds me. If that doesn't scream epidemic in our country, I don't know what does. So Dr. Susan Maples is an incredible source for diabetes, and she's speaking next week, and y'all have to tune in and listen to her. She'll blow you away. But what we know is that 1 in 4 diabetics is undiagnosed. 9 out of 10 pre-diabetics do not know that they have it. So we really have an opportunity to not only find it, but we also have an opportunity to educate. And again, we have that bidirectional relationship between PERIO and diabetes. So we do have a responsibility to educate. So we do A1C testing in the office, and so 6.5% or above. Now, our doctors are not diagnosing, they're actually referring them to go to their physician, but they are having a discussion with the patients. I also don't want you to get comfortable with, if you are within that normal pre-diabetes range, that can be, that may be false. The best thing to do, so I have a patient who is a Dr. Gina Pritchard patient. We collaborate together, also with Dr. Busky, of course, and he always has a normal A1C, but when he does his when Gina ordered his blood glucose tolerance test, which is the one on the far right, he skyrocketed. So we know that he is pre-diabetic, but he would have never known that. So Dr. Gina Pritchard says that with that blood glucose tolerance test, we can actually find pre-diabetes not just a decade, but sometimes 2 decades before it really becomes problematic. Great opportunity. So it's important to know that just 1% reduction in levels of A1C result in 21% reduction of deaths related to diabetes, 21% reduction of risk for diabetes-related illnesses, 14% reduction in heart attack. 37% reduction in microvascular infection. I will not talk codes, but this is what we use if you want to take a picture of it. And again, I have on here Dr. Susan Maples because she really is such a great source. So we have collaboration, like how do we do that? And we have to, again, give a shout out to Drs. Amy Doneen and Brad Bell because they really are the leaders in collaboration. We use, we do have patients that work with Dr. Bell, but most of our patients that we work with Dr. Gina Pritchard, who has been employed by Dr. Bell and Dr. Doneen, so she's very knowledgeable. She is practicing exactly the way Bell Doneen method is meant to be practiced, so we trust her. So how do we put this all together? So when I work with Gina or Paul, we, on our end of things, we are always looking at pathogens. So I don't know if you're doing the pathogen testing. We use Orovital, and I really like this one. So it has, you know, we've got our high-risk pathogens, and then we also have Candida and Strep mutans. I really, really like that I have an opportunity to talk to my patients about Candida, and we talk, this is where we talk a lot about nutrition as well. But we also have two other great companies that do pathogen testing, so I'll briefly talk to you about each one of those. Oral DNA is the first company that we used, and it was great. It's very easy. It's a spit sample. Again, like, it is easy for clients. It's easy for clinicians. It gives treatment recommendations, systemic antibiotics, and able to test. It also, they test for Candida and interleukins. That's an additional fee. HPV testing, and I could be wrong, don't take my word for it, but I believe they're also going to be doing a COVID-19 test. Dr. Cooch, let's talk about that then, because I might be lying about that, but I think they are doing that test too, or about to be. So MicroB-Link, this, I just love these graphics. They're so pretty. And Jennifer is the owner of the company and just a real sweetheart. And so if you have questions about this company, please call her, and she will answer those for you. So that she uses 5 paper points to sample the subgingival DNA. One of the things that I've talked to Jennifer about is I really like having sample of the tongue. And so you can take one of these paper points and you can actually use that, go as far back towards the tonsillar region as you can. And then treatment recommendation. Results are emailed with the turnarounds just a few days. I believe Jennifer said 3 days. We do not use this company, but I do love this company, and I do talk about this company with the clients that I work with. And so the treatment recommendations are systemic antibiotics, oral irrigation, PERIO therapy, depending on the patient's risk. And then we have Orovital biofilm DNA, and this is the company that we've been using the last few years. And it tests saliva, tongue, throat, supra and subgingival biofilm. We use a tongue swab, and then there's 5 paper points. Results are emailed to you. And then treatment recommendations with this company is antibiotic and antifungal rinses and creams. There is no systemic antibiotic. Now that's one thing with microlinks. I will say I talked to Jennifer about that because we really are, we just did not want to prescribe antibiotics with every single one of our patients. And so Jennifer educates and recommends that, you know, she absolutely agrees with that. So you have to look at your patient's risk. If you have a diabetic patient, a high-risk heart health patient, you have a cancer patient, then you most definitely want to consider the antibiotics. If they are not a high-risk systemic health patient, then why not try and treat them without the systemic antibiotics and then come back later and you could use it at that point. OraVital uses their antifungal antibiotic rinsing cream. It's very easy to use. Individualized treatment plans, and then they have maintenance rinses. We are a carry-free practice. We've been using carry-free for years and years, and I have to tell this funny story. I don't even know how long it's been. There's not a timer on here. I hope I'm not getting close to going over. But so we use carry-free. So CTX4 is the antibacterial rinse, and we use that with our moderate and high-risk patients. So I also noticed, and this was several years ago, I started noticing that my patients that were using the treatment rinse, their perio was improving. And with no other changes, and the only thing that had changed was the fact that they were using the treatment rinse. So, so I see Lacey, so fast forward, and I meet Lacey, and I'd never said anything to anyone other than my doctors in the office. And I'm telling Lacey, you know what? That treatment rinse, actually, it kills those perio pathogens, and it's beneficial. We should really be giving that to, I mean, we give that to all of our perio patients. Y'all should be doing that too. And she's like, Machell, there are a lot of doctors doing that. Doug Thompson's doing that. Susan Maples is doing that. And I was like, oh, here, I thought I discovered that. Not so much. But I told Dr. Cooch about that a couple months ago, and we got a giggle out of that one. So it really is, they do not advertise for perio with carry-free, but it is exceptional for perio as well as carries. So this is a graphic. Y'all are welcome to take a picture of this. It's a great graphic. I use this along with the results that we get from the pathogen results, and because I like that it's a visual. And whereas all three of the companies have great graphics, I really just love how this visually connects the mouth body. And so just snap a picture of that if you don't already have it. And I make copies of this for all of my patients as well and put it in their folder. So Gina and Paul's part of collaboration is the inflammatory biomarkers test. Now we can also do this in our practices. We actually will send some patients down to Quest. We can do it in our office too. We're doing blood draws. But I really like working with Dr. Pritchard and Dr. Thompson because, again, I think it takes a village, and the more of us that are educating our patients and caring for our patients, the more value that we instill, the better that they're going to take care of themselves. At least that's what I've seen with our patients in our office, especially our patients that we're working with Gina and Paul. So what we know is that, you know, the damage to the arterial wall has many contributing factors. So we know we have to look at cholesterol. Please know and please educate your patients that 50% of heart attack and stroke occur in individuals that do not have high cholesterol. We also look at blood pressure, blood sugar, Many doctors are already testing C-reactive protein, but we can actually do more, and that's where the Cleveland Heart Lab inflammatory biomarkers comes in. So we really know that the damage that these cause is going to lead to injury to the arterial wall, which is going to provoke that inflammatory process. You know, we know that research shows that inflammation with the arterial wall is a primary contributor to that vulnerable plaque formation and eventually could cause, you know, rupture. So understanding these inflammatory biomarkers is really beneficial and within dentistry, but also medicine, because if our physicians are doing this test, you're going to learn that some of these markers are going to indicate either sleep disordered breathing. We really want to look at obstructive sleep apnea, but it's also going to indicate PERIO and ENDO as well. So if we look over here, if you're looking at it and you look to the left, we have a healthy arterial wall. And then you kind of walk over a little bit and you're going to see, you know, in the yellow, it's like F2, it's F2 isoprostanes and then oxidized LDL. So within that, we know that the patient is at risk for disease. So I really like having this. I love it when Gina sends it over, and I always recommend that Paul sends it over too, because my docs and I love seeing this, because we know that our doctors that are doing this test, they are educating on lifestyle. Well, guess what? We can further educate on lifestyle. So again, huge opportunity right there. So let's just go ahead and walk down a little bit further. So now we have, you can see the yellow within that wall. So you can see that right there is the presence of disease. So that plaque has started to lay down. And this is where we start to get very concerned here. So we know, everybody just generally knows that C-reactive protein is a sign of inflammation. But Gina has really educated me that that is so big. It could be so many things. That could elevate. You could have a baby and it's going to elevate. You can go just a couple of days without sleeping and that could elevate. But one of the things we know is that it can also indicate an endo infection. It can also indicate PERIO infection. So it definitely gets their attention when they see that and they start thinking, oh, got to collaborate with my dental team. So let's walk over a little bit further, and you see this MPO and the LP plaque 2, and that's a really, really scary area to be. So we know at that time we have disease activity. So we have some chronic inflammation. That plaque is really laying down. And what most people don't realize, again, cholesterol, only 50% of patients that have a heart attack have high cholesterol. So we have this, we know that the arterial wall is inflamed, and then we have this cholesterol, so we've got that heat, that plaque that's heated up because of the inflammation, and then because of the cholesterol, it just bursts. And what happens, so when that bursts, we have, our body is so incredible, and it comes in, and it lays down a Band-Aid. That Band-Aid is a clot. And at that point, we're just waiting and waiting for that clot to dislodge. If it goes to the brain, it's a stroke. And if it goes to the heart, it's a heart attack. What a lot of people do not know, unless you are practicing Beldonine, is that if that LP plaque 2 is elevated, that is an indication that we have periodontal disease and periotherapy is needed. We also know that MPO is elevated with Gina, because I work with Gina, and then also now with Paul. Many times, more times than not, that is sleep disordered breathing, specifically OSA. So we really have to be looking at that as well. So when our physicians see all of those elevated, they're definitely going to refer to us to address. And just like the patient that I talked about earlier, he was elevated in all three of those. We addressed his disease. We also, we addressed the OSA, and the patient is within normal limits in his inflammatory markers. Pretty incredible that you can see what the mouth does within the arterial wall. And I don't know about you, but if that doesn't make you feel purposeful, if you don't all of a sudden have this incredible, crazy passion to go out and take better care of your patients, you need to call me, because I just need to rub off on you, because I love it. I go into work every Monday morning. Well, I haven't gone. I'm like into a month of our staycation. But when we're allowed to work, I'm not that girl who dreads going to work on Monday morning. I love waking up. I love going and taking care of my patients, because I know what I do really affects their quality of life. So this right here, again, I love folders for patients. And because believe it or not, your patients are reading more than you think they are, especially if you're talking to them about all of this. So we have the pathogen test on the left, and then this is a patient of mine and Gina that we did the inflammatory panel on, and you can see that MPO was elevated. That's mild peroxidase, by the way. I don't think I said that earlier, and I apologize. But that was elevated. The patient was going through a lot of life change, very stressed out, was not sleeping, had some insulin resistance, and just had a lot of issues. Lifestyle was addressed, reduced the stress, and MPO is now within normal limits. And again, I always add the middle graphic with the bacteria on the left and then the systemic connection on the right, because it has pictures and it makes your patients think. And I'll tell you what, I don't know how many referrals, tons of referrals come to us from our patients. They go out because we're talking to our patients about whole body health, that mouth-body connection, how oral pathogens affect systemic health. We're using lasers. We're doing these pathogen tests. We're working with doctors. That, again, I talk about instilling value. When you're doing all of this, that's going to be a result. My patients, I do not mean to scare my patients, but I have educated my patients so much. A lot of my patients have my phone number and then social media friends, and I have received at least a couple dozen, a little more than a couple of dozen, either text messages, a phone call from a couple of patients. Am I going to be okay not coming in for my wellness visit? I call Profi and PERIO maintenance wellness visits. And I'm like, you're going to be okay. You're going to be okay. But I have instilled such value that their oral health is their responsibility. It's my responsibility to take care of them. And now that we're at home and we can't work, they're concerned about their oral health. Patients do care. They may not know how important it is. That's our responsibility to educate them. So when it comes to the referral piece, if you do not know how to do a referral, this is on AOSH's website. Again, go check that out. It's amazing. But this is a nice little cheat sheet for you doctors and hygienists, and you can kind of play around with it. And if you have more questions, you are more than welcome to reach out to me about it. But send these referrals to their physicians. They have to keep those in their charts. And guess what? You start sending these referrals over to the physicians, whether you talk to them or not, they're going to see this and they're going to start thinking, wow, I didn't realize. realized that PERIO pathogens played a role in hypertension. I didn't know they played a role in heart health, period. I didn't know they played a role in diabetes. Well, a lot of doctors do know the relationship between PERIO and diabetes. But RA, brain health, this is so important. It's such a key piece. This is an infographic that doctors, you can put in that folder that I'm recommending, hygienists, a folder that I'm recommending that you use to send home with your patient. I've had patients come in, like new patients come in, that were given these infographics from existing patients. Here's another one. That's an easy one to use. And then here's one that you saw earlier, the mouth-body connection. I would like to thank, there are so many people that I need to thank for, they just make me a better person. I love learning from them. I love their kind hearts. Carrie Lepachek really has taught me so much about PERIO pathogens. Dr. Chris Kammer, founder of AOSH, all of you who know him know just how big his heart is, and he really is just an amazing human being and a dear friend. Gina, beautiful inside and out. She helped me so much with this presentation. Thank you, Gina. Dr. Cooch, thank you for having me. And then most important, the two in the middle, Bruce Baird and Cindy Lou Baird. They are family to me. I love them. I am here because of them. So last but not least, the purpose of life is not to be happy. It is to be useful, to be honorable, to be compassionate, to have it make some difference, that you have lived and you have lived well. Catherine Gilliam, I know you're smiling at this right now. I can see you on there. Catherine and I speak together, and we use this at the end of our presentation at PDA. I really believe that when we take good care, when we are loving people well, the result is happiness for us. If you'd like to reach me, this is how you can reach me, and I really appreciate all of you listening to me, and I would love feedback, and that would be appreciated. So thank you.
Thanks, Machell. That was such a great presentation. So we've had a lot of questions coming in. I think we have time to answer just a couple of those. I wanted to let you know that Kendra Sellers, who was one of our presenters last week, she wrote in that, yes, Oral DNA is creating a COVID test, and she's actually speaking with them about that today. So hopefully we'll get some more info. Yeah.
Thank you for that. I'm really excited about that.
Yeah. We have a question from Hilda and Peter. We're going to put theirs together. There's actually a lot of questions wondering who's paying for the testing and counseling and how much you're charging per test.
That's a really good question. So are we talking about the pathogen test? So
yes, I'm assuming that's what they're asking.
Okay, so all the testing, so I know, the A1C test is, we use, it's a throwaway, and it's about $190 for 20 kits, and we charge $20 per test. However, if the patient, we really are concerned about diabetes and they do not have the money, we will do it at no charge, that we don't have to do that very often, or charge them cost $10. The pathogen test, we use OraVital, and we charge $150 for the test. The test, they will send you the test, and I can't remember how Oral DNA does it, but I know that, and since we have an expert on here, maybe you can tell us, but I know that with MicroBlink and also with OraVital, being that that's who we use, they will send you all of the tests for free. You do not get charged until you send them back. So I know with OraVital, they're $110 per test. We charge $150. Jennifer said with MicroBlink, hers is also $110, but if you put 3 tests in a kit, she actually will reduce that to $100 a test, which is really incredible, Jennifer. So thanks for offering that. And then if you want to do the inflammatory testing in your office, there's 2 ways that you can do that. You can do a full panel, and a full panel is $110. And that's going to test all of them. But you can also do one just for those that are linked to oral health, and then, of course, you know, that airway. And that one is $40. And it's going to test just the LP plaque 2, MPO, and C-reactive protein.
Okay, perfect. So speaking of acronyms, John is asking if you have a resource for the acronyms that you used today in your slides. Can they contact you for that?
Yes, because I don't really, so like my inflammatory markers. Cleveland HeartLab is a great place to go. If he can also call me, write my number down and call me, and I would love to have a conversation about that too. I'm sorry, I didn't even think about that in the presentation.
Okay, perfect. Thank you. Sonia is asking, do any of the biofilm testers evaluate the cravascular fluid for glucose levels, or mainly pathogens?
That is a question for the pathogen companies. I do not know that answer, and I'm very sorry.
That's okay. I don't even know if I said some of those words correctly. So, and then let's take time for one more question. Scott is wondering, is there a higher correlation to systemic due to PERIO or endo disease?
Actually, endo.
Mm-hmm.
Actually, endo is higher than PERIO. I don't know the exact percentage. I know that Brad Bell talked that at, I heard, oh gosh, I believe that was at a scientific session. It may have been preceptorship. But yes, endo is more of a risk factor than PERIO.
Okay. Dr. Cooch, do you have any questions or feedback to anything to add? Pam, are you there? Oh, hold on one second. We're having a little audio problem. Okay.
While we're waiting, I just have to say,
I was just giving you that pregnant pause of silence there, you know, for effect, dramatic effect.
Oh, thank you.
Yeah. Let me jump in on that last question real briefly. The primary pathogen in a lot of those endodontic lesions is strep viridans, and the reason they link this to the heart attacks is the thrombi. The number 1 pathogen or bacteria found in those, and it's found 78% of the time, and it's the most common bacteria there is strep viridans. And you know, I've just gotten to the point in my life with biofilms that there are no coincidences. When you know you see that, we used to, you know, see a lot of candida in patients that had, you know, severe dental caries and thought, oh well, it's just there, or like the environment. And now it's like, you know, we all recognize that it's a major player in dental caries. So when it comes to biofilms, there's no coincidences. If there's a microbe present, it's there for a reason. So that's one of the reasons that endodontic lesions, I think, play such a significant role, particularly in heart attacks and maybe in strokes, and certainly in strokes as well. I just wanted to say, Machell, you are like a bright, sunny day. I love your passion and your enthusiasm. You are just a star, and I could listen to you all day long. I was just sitting here reflecting back. You know, I've been in dentistry for a long time, and just reflecting back how far the profession of dentistry and dental hygiene in particular have come. I mean, when I was in dental school, the practice of dental hygiene was all about creating glassy, smooth roots and scraping the calculus off the teeth. And now it's like, you know, your whole presentation, we didn't even talk about that today, right? Your whole presentation was all about heart health and how the oral systemic connection, and it's just, I think it's so gratifying for me to see our profession get to the point that we're really healers and we're really helping people just in their overall health, not just, scraping their teeth. Also just wanted to make a comment here. I'm reading a lot of the comments from people who are attending, and we've had such a great turnout, and I want to thank you all for being a part of this. Everybody has seemed, I'm enjoying this so much, and it's like everybody else is enjoying it so much too. And we broke a mark today. We have over 1,000 registrants now on CONNEXT. And so
wow.
I just want to just give a big heartfelt thanks to all of the presenters, all of the Carry-Free team that have worked so hard behind the scenes to make this happen, and then all of the people that have chosen to be a part of this. It's been such a delightful community during this time of kind of social distancing and isolation. It's like I look forward to this every day. So anyway, I just want to thank you all. And Machell, you and I still need to record a podcast.
Yes, we do.
That's another story we won't go into, but it was great hearing your voice.
Yours as well.
And I just wish everybody to get out if you can, step outside, get some fresh air, and smile. And thank you all, and have a great weekend. Thanks, Machell.
Thank you all. Thank you so much. Have a happy day.
All right.
Bye-bye.
Thank you both so much. Before we let you go, I have just a couple of things to mention. Please join our Facebook group if you haven't already. You'll be directed to the link after the session today. We're posting the recordings in the group and also emailing them each day with the CE info. And for CE, once you complete the quiz and evaluation form, you'll get your certificate within a 1 to 2 week period. So we want to make sure that you guys don't miss Monday's course. We have Susan Maples, and her course title is PERIO, Diabetes, and CVD Connections and Collaborative Treatment in the Dental Office. Last but not least, thank you to all of you for attending. We're having so much fun bringing you these courses and giving us all a bit of distraction from what's going on. If you guys had any questions that didn't get answered today, please feel free to reach out to Machell. She has her contact info on the screen. Have a great weekend, everyone.
Thank you all. Have a happy day.